on this Saturday night, ramping up vaccinations in COVID hotspots. Ontario's new strategy to curb the crisis.
It's pouring your water where the fire is burning hottest.
But cases keep rising in Canada. The fake documents travelers are using to avoid COVID-19 tests and get on flights to Canada. Japan's COVID emergency with just 3 months until the games begin. Plus 40 days hiding in caves, an experiment in unplugging.
Global National with Robin Gill.
Good evening and thank you for joining us. Canada's largest province is taking a new approach to the rising number of COVID-19 cases by using pop-up vaccine clinics in hotspots. It's a strategy that has worked in other parts of the country, and Ontario could sure use it now. For the 12th day this month, the province is reporting 4,000 new cases. So for the many who lined up to get a vaccine today, it was a huge relief. Same goes for the doctors working in hospitals that have hit a breaking point. Mike Drolet has our top story tonight.
There was little in the way of publicity for this vaccine pop-up, and little need as well.
I got lucky just passing by here, drove by, saw that there was a line, hopped in, and I feel good, honestly. I feel blessed.
Word spread quickly in Toronto's Thorncliffe Park neighborhood. 3,000 vaccine doses were made available as part of a new strategy to target the city's hotspots.
The lineup, it's pretty long, but to be honest, I've seen a lot worse.
It's actually a provincial plan, but with low vaccine supply, Ontario has yet to say how it will service its top 74 hotspots. The City of Toronto made the decision to use what it had now in the areas that need it the most, making the vaccine available to anybody over the age of 16.
So they're lining up rather than waiting, in some cases, weeks or months before their turn comes up.
It's a similar tactic used after an outbreak in Prince Rupert, BC, which saw its weekly cases drop from over 100 to only 3 last week after a push to vaccinate.
Totally the right move. It's pouring your water where the fire is burning hottest. It protects essential workers. It protects vulnerable communities.
And while that's the goal in Ontario, the statistics show that residents in high-risk neighborhoods are less likely to get vaccinated, in part because of language and cultural barriers. To that end, the city is hiring community ambassadors, a move applauded by top doctors, who now believe we could see the third wave begin to dip in a few weeks.
So, of course, the situation we're in is far, far, far from ideal. But there are real arrows pointing in the direction that we're going to get out of this situation. And there's also real arrows in the direction that the midterm and longer term future look good.
But that positive outlook comes with an important caveat. We can't get complacent. Mike Drolet, Global News, Toronto.
As Ontario struggles to get a handle on its COVID-19 crisis, other parts of the country are offering to help. Among those stepping up, the Atlantic provinces, which have been relatively successful at stopping the spread of the virus. But as Ross Lord explains, pitching in comes with its own problems.
In the spirit of cooperation, efforts to help Ontario get a grip on COVID-19 include an unlikely contributor, Atlantic Canada. Despite struggling to keep up with regular demands on their healthcare systems, Nova Scotia and New Brunswick are signaling they'll pitch in as much as possible.
While New Brunswick does not have the available resources within the regional health authorities, any healthcare workers who are retired or working outside of the healthcare system are being encouraged to assist.
I know we have ventilators available. It's a question of whether or not Ontario could use those. They're focused on resources more around nurses, ICU nurses, and doctors.
The federal government offers to pay for their travel, salary, and accommodations. The PEI government suggests it's as open as possible to helping Ontario, but leading the region's goodwill effort is Newfoundland and Labrador, specifically the nonprofit group Team Broken Earth. The group is best known for sending doctors and nurses to natural disasters like the earthquake in Haiti. Its founder, Dr. Andrew Fury, is now the province's premier. His wife Allison, who's also a doctor, volunteered immediately to help Ontario. But on top of logistics like travel and licensing, there are other complications when one region offers to help another get through a healthcare crisis.
So there is a political risk. So if the government promises resources and doesn't then end up needing them, then they're a good neighbor. But if things get out of control and they're left without the resources that they need, then the government will be accused of poor judgment by its own citizens.
And there's growing pressure to protect their own provinces. Since talks to help Ontario started, a rise in cases has forced Nova Scotia to impose new border restrictions, a measure caused in part by visitors from, you guessed it, Ontario.
One of our current clusters was the result of family and friends gathering with people who had recently come from Ontario.
Another example of how challenging it is to balance competing pandemic priorities. Ross Lord, Global News, Halifax.
For at least the next month, flights from India and Pakistan are no longer allowed to land in Canada. Both countries are struggling with a surge in COVID-19 cases believed to be linked to a new variant. This year, a high number of positive cases have been arriving in Canada by plane. And as Sarah McDonald explains, some passengers have been caught with fake health documents.
They're among the last air passengers to touch down on Canadian soil directly from India or Pakistan for at least the next month.
Lucky. I'm going to Exchange Hotel Vancouver for my 3-day hotel quarantine.
Yeah, I'm going to isolate.
How long for?
14 days.
These travelers from Delhi making it just in the nick of time as federally imposed travel restrictions targeting COVID-19 hotspots went into effect on Friday.
Let us remember that Canada already has in place some of the strongest measures of any of our peer countries around the world.
So how exactly do COVID-19 positive travelers from a wide range of countries and continents and those variants of concern keep arriving in Canada? In the last 2 weeks alone, dozens of confirmed cases have been detected in air travelers arriving at Vancouver International Airport. All of those passengers ultimately found to be carriers of COVID-19, required to produce a negative test result taken within 72 hours of departure before boarding. But Canadian border officials confirm not all of those certificates are genuine, with more than a dozen travelers found to be in possession of suspected fraudulent test results at Canadian airports of entry since those new travel restrictions came into effect. Some 36 suspected forged documents intercepted at land borders over the past 10 weeks.
What we need to ensure is that people who are returning to this province are in fact abiding by the quarantine rules, and the feds put the resources and the enforcement necessary to ensure that that continues to take place.
It's impossible to know how many fraudulent documents could be making their way here from international destinations. But British government officials say in the United Kingdom, border guards are busting more than 100 travelers with fake test results on a daily basis.
What I would suggest is that more resources be put into creating a system where you can't use those fake certificates.
Public health expert Kelly Lee says the federal government must work more efficiently with provinces.
The worst case scenario is we have a variant where the vaccines don't work against.
With hundreds of travelers arriving in Canada found to be flouting federal testing or quarantine mandates this month alone, despite the risk of 6-figure fines and prison time. Sarah McDonald, Global News.
Procurement Minister Anita Anand says Canada is ready to assist India with PPE and ventilators. India's government is trying to get oxygen tanks to bedsides where patients are suffocating from COVID-19. Today, India reported more than 346,000 new cases of COVID-19 and more than 2,600 people died in just 24 hours. But it's believed the cases and deaths are far more than what is being reported. Doctors blame the rise in cases on the government, allowing religious festivals and election rallies. The United States is lifting its pause on the use of the Johnson & Johnson vaccine. It was put on hold for more than 10 days after a handful of reports of people developing rare blood clots after getting the shot. But health officials now say the vaccine's benefits far outweigh the risks. And as Jennifer Johnson explains, it could be in Canada as early as next week.
Shots of the Johnson & Johnson COVID-19 vaccine have been cleared to be administered immediately after 2 federal agencies looked at the evidence and decided its benefits outweigh the rare risk of blood clots.
In the end, this vaccine was shown to be safe and effective for the vast majority of people.
Prime Minister Justin Trudeau says Canada will receive its first 300,000 doses of the J&J vaccine next week as it pushes the U.S. to release its excess vaccines.
The U.S. was able to send us 1.5 million vaccines a number of weeks ago. We continue to work very closely with them.
Johnson & Johnson came under further scrutiny after the Food and Drug Administration inspected the Maryland facility making the shots and found serious violations, including unsanitary conditions and ingredients not stored properly. Health Canada has stood by approval of the J&J vaccine and is confident doses coming to Canada are safe.
The supply that was coming to Canada
was not affected by the issues that emerged at the plant.
Hundreds of thousands of vaccine appointments in the U.S. are not being filled as vaccine hesitancy grows. This vaccination clinic in Indiana with 1,200 slots was canceled after so few signed up.
When they opened the appointment website, we started checking it earlier this week, and we only had 97 people.
Adding to the problem, reluctance among minority populations. The U.S. Surgeon General is launching a campaign with celebrities encouraging everyone to get vaccinated.
So we're pairing doctors, scientists, and health officials with influencers and organizations with accounts that can reach millions of Americans.
200 million shots have been administered in the U.S. so far, still not enough to achieve herd immunity. The challenge now, convincing 1 in 5 Americans who don't want to get vaccinated the shots are safe and effective against this potentially deadly virus. Jennifer Johnson, Global News, Washington.
Japan is under a third state of emergency tonight. COVID-19 infections have been steadily rising for the past month, and tonight a quarter of the country's population is living under new and even tougher restrictions. And there are just 10 weeks to go until thousands of athletes descend on Tokyo for the 2020 Games. As Crystal Gumansing reports, the Olympic Committee is making changes to keep the already delayed Games on track.
Event organizers for the Rugby Sevens competition tried to make it fun. Well, cool, the ball-carrying robot car is a matter of function. Olympic organizers are trying to ensure qualifying events, which only restarted this month, are COVID secure. Limited ball handling for non-players, gloves for everyone else, and loads of disinfectant. The Tokyo 2020 president says with a third state of emergency in place, we need to take even stronger COVID-19 countermeasures than even before. Despite the public not being allowed to participate and no cheering or singing, a police officer involved in the torch relay tested positive for COVID-19. It's the first case linked to the event so far, but infections across the country are rising. On Friday, Japan's prime minister outlined the state of emergency, describing it as short-term, intense, and powerful. The surge in cases isn't as bad as what's occurring in Canada, for example, but health systems in Japan are under pressure. As people in Tokyo once again ask how the Games can go ahead given the current situation, Canadians are training. Cyclist Haley Smith spoke to Global News about the challenges posed by the pandemic on these Games before leaving for a qualifying event in Europe.
I think I go through waves where I'm able to accept that reality and focus on what I can control, which is just my daily efforts on the bike and in the gym and in terms of recovery.
That focus and desire to compete is present for all athletes.
You know, we're confident in the ability to take a team to the Games, and we're confident in the ability of the organising committee.
So for now, the world is getting ready for the Olympics, despite a resurgence of the virus and stricter measures to curb its spread in Japan. Crystal Gumansing, Global News, London.
Indonesia's Navy now believes all 53 people on board a missing submarine are dead. Authorities now believe the sub sank and cracked open. Search crews have found several items from inside the vessel, including prayer rugs. So far, no bodies have been recovered. The submarine made its last dive on Wednesday as part of a training exercise off the coast of Bali. An investigation is now underway into what happened. The Navy initially said it believed an electrical failure may have caused the sub to lose control. Coming up, pressing pause, how a group in France spent 40 days in hiding.
Tonight on The New Reality, our medical system on the brink.
What if you don't have nurses? What if you don't have doctors?
See what the pandemic has really done to our healthcare heroes.
It's come at a cost.
Tonight at 7 on Global.
Tonight, we continue our coverage of the allegations of sexual misconduct in the military. The parliamentary committee looking into this has heard testimony from the woman who's making the accusations against former Chief of the Defense Staff, General Jonathan Vance. We also learned that a key advisor to Justin Trudeau was made aware of the allegations. Our Mercedes Stevenson is now putting questions to the Deputy Prime Minister. But before we get to what Krista Freeland had to say, Mercedes, guide us through the testimony.
Robin, Major Kelly Brennan shared explosive testimony on Thursday during her appearance before a parliamentary committee. Brennan is the first woman who came forward to Global News, accusing the country's former top military commander of sexual misconduct. Brennan told the committee that Jonathan Vance fathered 2 children with her and did not pay child support. She also said Vance told her that as the country's top soldier, he was untouchable and owned the military police. Global News spoke with Vance in February, and at that time, he denied all allegations of sexual misconduct, and he also denied having fathered children with Brennan. Deputy Prime Minister Krista Freeland called Brennan's testimony deeply troubling.
It's clear to me, as we've heard from numerous reports in the past, that there are some deep problems in the Canadian Armed Forces with sexual harassment and with treatment of women, and that has to end.
We also learned this week that the Prime Minister's closest advisor, his Chief of Staff, Katie Telford, knew in 2018 that an allegation had been made against Vance. Experts warned these kinds of alleged secrets pose a major security threat, leaving the country's top military commander open to blackmail. Defense Minister Harjit Sajjan has faced intense criticism for not doing more when he was made aware of the concerns about Vance's behavior. But the Deputy Prime Minister defended both Sajjan and Telford, along with others in her government who knew of the concerns.
These are very difficult issues to handle, especially when there are questions of confidentiality and the due process that everyone deserves. And while I had no knowledge of this, I have a lot of confidence in the people who handled this difficult situation.
The military will be creating a top-level position to deal with sexual misconduct and racism, but the government still hasn't committed to an independent watchdog that would report to Parliament, a move seen as crucial by so many experts and survivors of sexual misconduct. Robin?
Mercedes Stevenson in Ottawa, thank you. And you can watch the full interview with Deputy Prime Minister Krista Freeland tomorrow on the West Block. BC has seen more anti-Asian hate crimes per capita than anywhere on the continent. Still ahead, Global digs into the disturbing trend.
You're watching Global National.
The origins of the new coronavirus in China and disparaging comments made by world leaders about the pandemic have all inflamed racism against Canada's Asian community. A federal report found over 1,100 anti-Asian hate incidents, and those were just the ones reported. Not all are. Sophie Louie has been digging into the disturbing trend in a special program called Hidden Hate, Anti-Asian Racism. Sophie?
Robin, the rise in anti-Asian racism has, of course, been seen across North America. But according to one report, BC has had more incidents per capita than any other region in the continent. It can be things like graffiti or hateful comments like Kung Flu or China virus. We heard that from former President Donald Trump a lot. But as we know, verbal assaults can quickly escalate and become physical.
What happens is that you may have a suspect or a person of interest who today is just angry and yelling at somebody and perhaps is just giving us a glimpse of some hate-related comments, and tomorrow that same person decides I'm gonna do something criminal. I'm gonna assault the person. I'm gonna punch him in the head. I'm gonna kick his car.
And that's pretty much what happened to a woman named Trixie Ling. She was just out for a walk in Vancouver last May when a man said racist and sexist comments to her and then spat in her face as she walked by him. Now, almost a year later, she hopes that by speaking out and sharing her story, she can spark these more meaningful conversations about racism.
It really sparked something in me. It's almost like this catalyst, and particularly a lot of that was anger. Like I had so much anger and rage that somebody could do this to another person, like being really the dignity of a person, not recognizing the humanity of another person.
And on our Global News special on anti-Asian racism, Robin, we'll hear from more Asian Canadians about their experiences. Governor General Adrian Clarkson will join us. We'll also hear from NBA star Jeremy Lin and others right across this country. And we'll explore the hidden hate that has existed in Canada long before COVID even began. That's tonight at 7:30. Robin?
All right, good stuff. We're looking forward to it, Sophie. Up next, time flies when you're in isolation. We'll explain when Global National continues. It's a full house at the International Space Station where 4 astronauts just arrived on the SpaceX Crew Dragon capsule. With 2 SpaceX crews on board, the station now has 11 astronauts. It's the biggest crowd in over a decade. But not for long. On Wednesday, this first SpaceX crew is set to fly back to Earth. The newcomers will stay for 6 months to help with scientific research and upgrades to the station. A team of volunteers in France were greeted with cheers at the end of their 40-day stay in a deep, dark cave. 8 men and 7 women took part in the experiment. They were completely isolated with no light and no phones. Think about it. No contact with the outside world, no concept of time. They had to follow their biological clocks to know when to wake up, when to sleep, and when to eat. For some, when the end came, they thought there was still a week or so left. Scientists hope the study will reveal more about how people adapt to drastic changes in living conditions and environments. Pas possible for me, though. That is Global National for this Saturday night. I'm Robin Gill. Tonight, your Canada is Barrier in BC. We'd love to see your corner of the country, so please keep sending your photos to viewers@globalnational.com. Thank you for watching. Good night.